This is Mary, a teacher at a Vanguard school. She doesn't know what that means, so she did what every 21st century researcher would do. But Google is no help. Google tells her that it means to lead the charge. She eventually goes to the intranet and finds that Vanguard is the foremost or leading position in a trend or movement. But where does this come from? The division developed guiding principles to help schools continue the implementation of Compass to 2015. Ensure that all schools fully implement strategies that support the Compass 2015 outcomes for student success. Hold all schools accountable for implementation of the strategic plan. Support all schools with the implementation of the strategic plan while recognizing that all schools are at different levels of readiness. Implement major components outlined in Compass 2015 given available resources and the need to limit the number of initiatives impacting schools. Develop expertise in schools to build capacity and provide support for key initiatives outlined in the strategic plan. Does that make sense? Let's get on the same page. The division created Compass in 2015 with 5 strategic objectives. The first strategic objective is what aligns with integrating instructional technology Vanguard. Strategic objective 2 aligns with balanced assessment Vanguard. And strategic objective 3 is aligned to the responsiveness to student needs Vanguard strand. These 3 Vanguard strands directly support improving student achievement. Let's take a brief overview of the 3 strands. Integrating instructional technology puts the focus on technology, but does that mean that they will not have balanced assessment? No. Does that mean that instructional technology Vanguard does not respond to student needs? No. It just means that they will have access to additional technology resources and additional training in support of technology. Now, balanced assessment, will they not use technology? No. Does that mean that they will not respond to their student needs? No. It does mean that they will receive additional training in assessment literacy and the use of common assessments. Responsiveness to student needs will focus on equity. Does that mean that they will not focus on technology? No. Does that mean they won't have balanced assessments? No. What it means is that they will have access to training and resources to implement and document strategies to address individual student needs. Although each school has a Vanguard focus, the balance of all 3 is what improves student achievement. This is Joe, the overachiever. He knows everything and has volunteered to explain the Vanguard strands to Mary in detail. One day, Mary and Joe were in the waiting room of the doctor's office, and Joe had a great idea. You know, responsiveness to student needs is a lot like the healthcare system. Take Dr. Smith. She has 100 patients. She treats them differently according to their needs and constantly assesses their health. Sometimes she has to take a different approach according to their risk factors, so she differentiates her wellness plans. For instance, Sally is in perfect health. She wants advice to prepare for her first marathon, so Dr. Smith meets her needs. Bob is a managing diabetic. Dr. Smith approaches his wellness checkups differently because she is meeting his needs. Jane is a hypochondriac. She always has something wrong with her, but Dr. Smith reassures her because she is meeting her needs. Jared has no health insurance, but Dr. Smith continues to give him wellness checkups and meet his needs because she knows it's the right thing to do. And then there's Mike. During one of his assessments, she realizes Mike has become at risk for a heart attack. He has high cholesterol, high blood pressure, he's overweight, he has a poor diet, and there's a definite lack of exercise. So Dr. Smith freaked out and laid him on the table to begin a triple bypass surgery. Is this a good idea? No. Instead, she uses her resources and collaborates with her colleagues to determine her next steps. They decide Tier 2 intervention is appropriate. So Dr. Smith calls the cardiology team consisting of the cardiologist, the nurse, the nutritionist, the personal trainer, and the pharmacist. The team collaborates to determine a course of action for Mike. They prescribe diet and exercise first. After 4 weeks, the checkup reveals the need for medication to help Mike recover faster. 4 weeks after that, Mike's risk moves down significantly and goes back to normal checkups without cardiology team support. Okay, Mary, that's when Tier 2 works. What do you think happens when the team's intervention is not enough? The cardiologist refers Mike to the heart surgeon who determines bypass surgery is imminent and extremely necessary. Mike recovers well from the surgery and returns to normal checkup status with the primary care provider. Did Dr. Smith conduct the surgery as a first step? No, she went through the multi-tiered system of response. Then Mary became curious. What happens if the bypass surgery doesn't work? You see, Mary, the focus of responsiveness to student needs is on classroom instruction, where differentiation and responding to individual student needs is interwoven with working relationships, much like the relationship Dr. Smith has with Mike. Without that relationship, Dr. Smith would never have responded to Mike's needs. This has been Responsiveness to Student Needs Vanguard in plain English.